Hi everyone. In today's video, I'm going to be going through something a little bit different in that I'm just going to be going through some conditions that are associated with rashes. Now, this is going to be a two-part series in which I go through my top 11 rash conditions, and these are usually conditions that are seen clinically. That's why I want to go through them. So in this video, which is part 1, I'll be going through numbers 1 to 6, and then in the next video, I'll be going through numbers 7 to 11. So let's get started. The first rash that I want to talk about is, or rather the condition that I want to talk about is erythema infectiosum. And I just love this name because it just sounds like some sort of Harry Potter spell, like when you curse someone with erythema infectiosum, I don't know. Anyway, erythema infectiosum isn't as fun as it sounds though, since that it is a contagious viral infection. So the thing with any viral infection is that usually the therapy or the treatment that we have for that viral infection is it's usually supportive. Antivirals are only used in highly serious scenarios, and erythema infectiosum is one of those conditions where we usually don't use antiviral medications unless the child, which is usually affected by the condition, children are usually affected, does present with very serious symptoms. So as I mentioned before, this is once again a contagious viral infection, and what it causes is a blotchy and raised red rash. So once again, blotchy essentially means that it looks very sort of irregular in its shape, and it may be darker in some areas compared to others. And raised means that it's inflamed, because inflammation, one of the 5 cardinal signs of inflammation is swelling. So if the rash itself is raised, then there has to be some element of inflammation present as well. The interesting thing about this rash is that its morphology, or its shape, is in the form of what we call a slapped cheek rash. And this is quite a violent method of describing the shape of this rash, but essentially the slapped cheek rash is, or the morphology type that is described by the term, is that it usually presents on the face. So slapped cheek rashes are present on the face, and they look like the person has been slapped by another person, because in that case their cheeks look very red, and there might be lines present as well. Those rashes may be present in lines. So usually on children, when you see a slapped cheek rash, it can be attributed to erythema infectiosum. Now, in terms of the illness itself, so if we associate with erythema infectiosum with maybe a fever, the illness itself is very mild, so we describe it as having a mild illness. And in terms of its incubation period, which is how long the disease actually lasts, this is usually 1 to 2 weeks. Now, the interesting thing to note about this rash is that although I did mention that the rash is contagious, or erythema infectiosum is contagious itself, when the rash actually occurs, it's not contagious anymore. So the interesting thing to note about this condition is that within the prodrome phase, or when the child has not shown the symptoms of the rash yet, but they are infected with the erythema infectiosum bug, they are infectious. But once the rash appears, they are no longer infectious. So no longer contagious. So no longer contagious once rash appears. And there are 2 main causative agents that have been identified so far as to cause erythema infectiosum. One, which you may have heard, is called parvovirus B19, and a less common cause of erythema infectiosum has been identified to be New Haven coronavirus. So, as a quick review, erythema infectiosum is a contagious viral infection that can cause a blotchy and raised red rash, which we describe as being a slapped cheek rash. It causes a mild illness that lasts for 1 to 2 weeks, and the children are no longer contagious once the rash actually appears. And the main causative agents which have been identified include parvovirus B19 and New Haven coronavirus. The next condition that I want to talk about is called Coxsackie HFM disease. Now, this disease is quite self-explanatory in its naming, in that firstly, if we talk about Coxsackie, Coxsackie is the name of a virus, so Coxsackie gives us an indication of what the causative agent for this disease will actually be. And HFM is actually an abbreviated form for hand, foot, and mouth. So colloquially, this condition is called hand, foot, and mouth disease. Now, it is a common condition that is found mainly in children, as is what we saw with erythema infectiosum. And this condition causes for, as the name suggests, sores on the hands, feet, and on the mouth, usually on the tongue. So it's, as I mentioned before, developed from the Coxsackie group of viruses. And the rash itself, or the condition itself, can last for 7 to 10 days. In terms of the morphology of this rash, it actually appears on the surface of the skin, is that we get blisters, and I highly recommend you looking at a picture of this rash. But the key features of the Coxsackie HFM rash is that we get blisters with an erythematous base. So the base of the blister itself is quite red, and some can be burst, and burst blisters cause for a fluid to leak out of the actual rash. So I'll just write fluid leakage. So Coxsackie HFM disease is mainly seen in children and is caused by the Coxsackie group of viruses. The disease itself presents with sores, which are characterized by blisters with an erythematous base, and if these blisters burst, they cause for the leakage of a clear fluid. They're usually present, or as the name suggests, they're present on the hands, feet, and mouth, and the actual condition itself lasts for 7 to 10 days. The next condition that I want to talk about is called Impetigo. And Impetigo is probably one of the most common conditions that are seen with children in school, and that's why they are called school sores. Now, Impetigo itself, once again, is a condition very common in children. It is a skin infection, and unlike the two conditions that we've talked about so far, it's not caused by a virus. Rather, it's caused by either Staphylococcus or Streptococcus bacteria. So usually Impetigo is not a serious condition just because how common it is, and Staphylococcus and Streptococcus bacteria are easily treatable by antibiotics. The thing with this infection is that it's quite special in that Staphylococcus and Streptococcus bacteria are normally present on the skin anyway. So what actually allows for them to cause an infection is that there is a breach usually in the innate defenses of the skin. So the skin itself essentially loses its integrity, and a breach in the skin occurs, maybe because of a cut. So impetigo is also described as being an opportunistic infection, in that although the Staphylococcus and Streptococcus bacteria are normally present on the surface of the skin, since there is a breach in the skin surface, these bacteria see that as an opportunity to invade the body, and by invasion, they allow for these systemic influences such as a fever as well as a rash to be present. Now, thinking about conditions that cause a breach in skin, we can see that opportunistic infections such as impetigo can be exacerbated by eczema, which is characterized by a lot of itching, and itching, as you know, can cause for a breach or a break in the skin, which can cause bleeding. Cuts can also occur, as well as abrasions. And as you can see, these are quite common causes of breaches in skin, which can cause an opportunistic infection. Furthermore, in addition to the actual presence of this opportunistic infection, what we get is a rash, and the morphology of the rash is characterized by blisters similar to Coxsackie HFM, and these blisters crust as the disease progresses. And crusting of these blisters is actually a positive sign that we see with impetigo, because that means that the blisters have essentially moved from being highly associated with the presence of bacteria to having closed over, such that the disease can essentially not be passed on to other people. So the crust acts as a protective barrier from the skin to the external environment. And what that essentially means is that since the blisters are closed off, the children are less likely to be contagious to one another. So once again, I highly recommend you look at a picture of impetigo rashes, but essentially the rash appears as something that is golden because the crust that forms over these blisters is golden in color, and it's usually present near the mouth because, as we all know, children touch their faces a lot, and that's where a lot of these infections can manifest. So in review, impetigo, also referred to as school sores, is a skin infection caused by either Staphylococcus or Streptococcus bacteria. It's an opportunistic infection exacerbated by eczema, cuts, and abrasions, and it can be presenting as a blister or a confluence of blisters, which eventually crust over and give that rash its golden color. Next condition that I want to talk about is called scarlet fever. And scarlet fever is also known as a group A streptococcal infection. And if you've studied group A streptococcal infections, you remember that rheumatic fever is also caused by group A beta hemolytic streptococcal bacteria. And essentially, scarlet fever has the same causative agent here. It's caused by an, I'll reiterate, group A beta hemolytic streptococcal bacteria. Now let's break down this term. So group A refers to a specific classification that these bacteria exist within. Beta hemolytic refers to the ability of that bacterium to allow for the breakdown of erythrocytes, and essentially there are three different groups: beta hemolytic, alpha hemolytic, and gamma hemolytic. So beta hemolytic simply refers to the manner in which the particular bacterium is able to allow for the breakdown of erythrocytes, namely the breakdown of hemoglobin into bilirubin. And streptococcal bacteria simply relates to the morphology of the bacterium. Strepto refers to the individual subunits of the bacterium being in a line, and coccal refers to a circular shape. So there is many circular, essentially beads. Think of streptococcal bacteria as beads on a string. There are many spherical bacterium subunits being present in a line. So it's once again quite a common infection, and as you can see, it's caused by bacteria, not viruses. And it commonly manifests as what we call streptococcal pharyngitis. So pharyngitis is just a fancy word for a sore throat, and drawing another parallel between rheumatic fever and scarlet fever, we can see that rheumatic fever also manifests as streptococcal pharyngitis. So the symptoms of scarlet fever include, as I mentioned before, inflammation of the throat, so that's what pharyngitis literally means. And there is also, as is seen with all the conditions in this video, a pink red rash that's formed. And that makes sense because this condition itself is called scarlet fever. So we would assume, or we would kind of guess, that the rash itself would be red itself. So this rash is usually present on the abdomen, so across the abdomen of the child, on the side of the chest, and it's also usually present within the skin folds. So it may be present where the axilla is. If the child is larger in size and they have skin folds on their abdomen, then you may see some evidence of some rash presentation in those skin folds as well. Furthermore, a key or a pathognomonic feature of scarlet fever is the presence of a red tongue. And this is referred to as a strawberry tongue because the tongue becomes quite red in color. So, and that's why we call this condition scarlet fever as well, because the tongue itself turns red. This redness of the tongue is made more evident because it's contrasted with the paleness of the mouth. So the thing about scarlet fever is that it is diagnosed clinically, and complications of it can be suppurative, but they include rheumatic fever, and as you've probably guessed so far, these conditions are quite similar to one another. It can also be complicated as sepsis, and finally as otitis media. So, in review, scarlet fever is caused by group A beta hemolytic streptococcal bacteria, and it usually primarily firstly manifests as streptococcal pharyngitis, and it presents as a pink red rash that is present on the abdomen, side of chest, and on the skin folds. Another pathognomonic feature is the presence of a red tongue, which is contrasted with the paleness of the mouth. And complications of scarlet fever include rheumatic fever, sepsis, and otitis media. Diagnosis of this condition is based on clinical findings. Another condition that I want to talk about today is probably one of the most common conditions that you've seen clinically or in your textbooks, and this is chickenpox. Now, chickenpox is once again classically seen as being a condition that affects children, and its scientific or more formal name is a varicella zoster virus infection. So chickenpox is quite special in that it is very, very contagious. It is a highly contagious viral disease, and it causes a blistering, itchy skin rash. So to reiterate once again and to emphasize, it is a highly contagious viral disease, and how it clinically presents is through a blistering, so filled with blisters, a blistering rash, itchy skin, and usually a high amount of redness, so red skin. Now, a thing to remember, and this is not related to the pathology of the rash, but just something to keep in mind, is that children who do contract this disease should not go to school. And hopefully this is something that I've made abundantly clear. Since this rash is so contagious, it can easily spread between children. So it's highly important that those children who get this disease should not go to school and should be isolated at home. Symptoms of this condition include a low-grade fever. So as you can see, it has systemic effects. General discomfort, as is what comes with any sickness. And what's quite pathognomonic or very synonymous with chickenpox is an intensely itchy rash, which forms crusts. And this usually occurs over 5 days. Now, there are two things that I want to talk about in reference to chickenpox. And firstly, I want to talk about, I highly recommend having a look at a picture of chickenpox on the internet, because firstly, chickenpox is a condition in which the rash is quite generalized and it's not very specific to a particular morphology. Chickenpox rashes can present with blisters, erythematous bases. There can be other morphologies as well, such as purpura, not as significant as the breakage of blood vessels or the presence of any type of sepsis, but rather sometimes children itch their skin so much that they can actually cause for the breakage of blood vessels. There can also be other features such as solid raised eminences, which cause for the presence of that rash. And also they may be, and this is very rare, but there may be pus present as well. Another key thing that I want to talk about in reference to chickenpox is that it's quite an interesting infection in that it can become latent. So if anyone has suffered from chickenpox before, usually what happens is that the body does not clear the entirety of the infection, and instead in a child and an immunocompetent person, those virus particles go and hide in privileged areas. Privileged areas in the body include the nervous system. So essentially what happens in these immunoprivileged areas is that there is a reduction in the amount of surveillance by the immune system. So if the varicella zoster virus particles go and hide in this area, then there's a greater likelihood that they will survive, since the immune system is not patrolling in this area. Hence, it is immunoprivileged. And these varicella zoster viruses stay in this area for years and years on end. And when a person becomes older and immunocompromised, then they attack the body once again. And essentially, a varicella zoster virus in the future is referred to a shingles virus. So once again, to reiterate, as a child, a person becomes infected with varicella zoster. That varicella zoster is essentially cured in inverted commas, but goes and hides in the nervous system of the body. And over time, many years later, the person may become immunocompromised, and the varicella zoster virus seeks another opportunity to infect the person, and that causes for shingles to result. So once again, this feature of the virus is called a latent infection. So to review, Chickenpox or varicella zoster virus is a highly contagious viral disease causing a blistering rash with itchy skin and red skin. And it's highly contagious, which means that children who are exposed to this rash should be isolated. It causes a low-grade fever, general discomfort, intensely itchy and red rashes which form crusts, and this rash itself is highly variable in its morphology. It can be present with redness, blisters, some breakage of blood vessels internally under the skin. And another important thing to remember is that it can present latently later on in a person's life who has already suffered from chickenpox in the past. The final disease that I want to talk about in this video, which is part 1, is measles. Now, measles is probably one of the most virulent conditions that I have encountered. And when I say it's virulent, I'm talking about its reproduction number. Now, the reproduction number is essentially how many people are infected by one person being infected by measles. So say if we have a particular population and a person with measles entered that population, the reproduction number tells us that if that person comes in contact with people within that population, how many people will be infected from that one person. The reproduction number of measles is 15, which means that for every one person being infected by measles, 15 other people will be infected by that one person. So it's quite a dangerous and highly spreadable condition. Once again, measles is a viral illness and it causes a skin rash and fever. And it's quite serious because it can result in serious and fatal complications. These complications include pneumonia, encephalitis, which is inflammation of the brain. Oops, let me just get my pen right here. So encephalitis. And other symptoms that can include in this condition can also be general discomfort, a running nose, a dry cough, which is should give you evidence as to why this condition also causes pneumonia. So it's obviously a respiratory condition as well. And there can also be conjunctivitis. So it's really a systemic condition. Something that I want to stress with measles is that you can get what are called Coxsackie spots. And once again, this is something that I recommend you look at an image of on Google Images. Coxsackie spots are essentially white spots that are present within the mucosa of the mouth. So if you've ever conducted a mouth examination on a patient before, what you do is that you take your torch, you ask your patient to open their mouth, and you take the tongue depressor. And whenever you look at the inside of the cheeks of a patient, you'll usually see that it's quite pink in color, and it's quite normal. But with Coxsackie spots, you'll usually see white spots being present on the inside of a patient's cheek. And this is quite pathognomonic, or I would say probably the most pathognomonic feature of measles. So if you see the presence of Coxsackie spots in the mouth of a patient, then you can pretty much say that this patient has measles. The advantage of sensing these Coxsackie spots in the first place is that they occur before the rash occurs itself, which means that they are a very early signs of measles. And the earlier that we can identify measles, the greater the chance we have of not developing these highly serious and fatal complications. In addition to these Coxsackie spots, in terms of the rash, we get a blotchy and red skin rash. And the interesting thing about this rash is that it presents in what we call a shower rash morphology. So if I very crudely draw a person here, and I apologize for how this person is drawn. Oh my god, that is terrible. Obviously this person has DVT because one leg is more swollen than the other, but anyway, the shower rash presents in such a way in that it starts on the head and slowly spreads down throughout the body. So like you standing in a shower and the water flowing down your body, the rash firstly starts on the head and goes down to the feet. Now, the incubation period for this condition, which is how long the condition actually exists, is 7 to 12 days. And like with many viral conditions, the treatment is supportive. So obviously, there are no antibiotics that we can give to this patient. Alright, so in review, measles is a highly contagious condition with a reproduction number of 15. It's a viral condition that presents with skin rashes, fevers, a dry cough, and conjunctivitis, and serious and even fatal complications can include pneumonia and encephalitis. The highly pathognomonic and I would say key thing that you should be looking for is Koplik spots. And in terms of the rash, it presents as a blotchy and red skin rash, which occurs in a shower rash morphology, which starts from the head and goes down to the feet. Its incubation period is 7 to 12 days, and treatment is supportive. So today we've talked about 6 main conditions, which I think are one of the most common conditions that you'll see clinically, and they form 6 out of my 11 top rashes. And I hope everything has made sense today. Thank you very much for watching. Thank you for sticking with me for what is now over half an hour. And I hope you enjoyed the video. Thanks.